says here that you're experiencing some headaches. Do you have one right now?
No, I don't.
No? How often do you get them?
Recently, I've been having them a lot.
Okay.
I think it's from sinus pressure and stress and whatnot from the season.
Okay. You sound a little congested. Are
Yeah.
you getting over a cold?
Yeah, I've had it for about a week and a half.
A week and a half?
In between a week and...
Okay, okay, great. So that's no problem to work on you today. So lying face down would bother you, is that right? Okay, do you mind going side-lying today?
No problem.
Super. I see skin disorder. Could you explain that to me, please?
I have eczema and usually like perfume lotions and shampoos and different things like that irritate my skin on my fingertips.
Well, my oil is all natural, so that shouldn't be a problem. I don't see any open sores here, so you should be okay with that.
Okay.
Allergies, is that what you're allergic to?
Everything.
Everything? Okay.
But I don't have a skin reaction. I just sneeze, and that's about it.
Okay. All right. Let me know if anything that I do does bother you, though, throughout the massage, whether it's the pressure, if it's too light, too deep, if I go across any tender points. Do you have any other injuries or illnesses that you haven't listed on here?
I have a shoulder problem.
Okay.
They think I tore some ligaments a couple of years ago, and it healed wrong. But other than that, I'm okay.
Does it affect your range of motion?
No.
Okay. Could I see a full range of motion? Okay, and that's full for you? Okay, let me compare it to the other one. There's quite a bit of a difference there. Okay. Does it hurt to lie on that shoulder?
Not for long periods of time. I mean, after long periods of time it does, but short periods I'm fine.
Good. Are you pregnant or trying?
No.
No? What is your goal for this massage today? How would you like to feel?
Complete relaxation.
All right, super. Is it okay if I do some therapeutic massage also involved in with that?
That's great.
Great. Stretches and such? All right, what I'd like for you to do is to dress down to whatever's comfortable for you. You can leave your underwear on for me, please. And you can hang your clothes up over there on the door. And get underneath this sheet right here, head here, facing the ceiling, so that you're laying on your back with your knees over the bolster. Okay, so good underneath. Any questions?
No, I think I'm okay.
Okay, I'll be in just a moment. Thank you. Okay. Let me know, please, Jenny, if at any time I do anything that hurts, anything that you don't want me to do, any areas that you don't want me to work. If you get too cold or too hot, either way, just let me know.
It feels good.
I'm going to work with some acupressure points first. This one is large intestine 20. It's great for sinuses. Stomach 7. Gallbladder 2. Bladder 1 and 2. How is my pressure?
Great.
When I go across any tender points, such as this feels tight. Is that tender?
A little bit right there.
Let me know, okay, so that I can work them. Okay, I'm going to do this at a counter strain. Let me know when this feels better, this point. Better this way?
It's not really tender when you're doing it from those angles.
Right. Okay, that's what we're looking for. This is a counter strain positioning as I'm pressing this point. Then I'm going to hold till I get a therapeutic pulse. And breathe. And I got it. So does that feel better now?
The left side, right up in here, is tender.
Let me know when I find it again.
Right in that.
Here?
Just above the occipital, right in there, on the bone. Right there, exactly.
Okay. Yeah, that feels weak. Is that tender? Okay. Let me know when it doesn't hurt as much. Is that
Right
better?
there.
Right there? Okay. And breathe. Is that better? Okay, let's start with the massage now. And everything should feel good. So remember, if anything does not, just let me know right away and I'll change my technique. Longitudinal and friction at the skull. Make sure it's a full friction with a bounce. And this acupressure part right here is called large intestine.
Very tender.
20. And it is tender? Okay. Would you like me to work it as a trigger point? No? Too tender?
Yeah.
Okay. So I'll work it at a counter strain then. Okay. Let me know when it feels better.
Right there.
There? Okay. No pain at all in this position?
No.
Okay, I got the pulse. So, does that feel any better?
Much better.
Good. Friction. Is my pressure too deep?
No.
Okay, good.
Just fine.
Pulling. Kneading. Deep longitudinal. And friction at the skull, where the muscles insert into the skull, right below it. That feels tender. I'm going to work this one as a trigger point, Jenny.
Okay.
Okay, so let me know when I'm at a comfortable pain level of 6, between 1 and 10.
Right there.
There, this is comfortable? Okay, take a deep breath in. Can I go deeper? Again, okay. Tell me when I'm at that level. Stop, okay. Is it referring anywhere?
No.
Is it releasing?
It's starting to.
Starting to? Okay. Can I go a little deeper?
I'm
just going to cause a stretch here. Does that increase the pressure?
You can increase the pressure now.
Okay.
I believe it's pretty much released.
Good. And it didn't refer anyplace else?
No.
Okay, great.
Not at all.
Okay, since we did some trigger point work, we're going to have to do some P&F stretches. So I'll go ahead and do those on the side now. The lateral stretches. Okay, to a full stretch. Resist against my hand that's on your forehead. 30% of your strength, and breathe normally. This is for 6 seconds. PNF stands for proprioceptive neuromuscular facilitation, and it's to increase flexibility, relax, and help to get rid of trigger points. And it's always done after trigger point therapy. Push again, 30% of your strength. Breathe. Seconds, relax, take a deep breath. Great. And now we'll balance it out by doing this side. Okay, resist against my hand, 30%, and breathe. And relax. And one more time, push against my hand, 30% of your strength. And breathe. And relax. Great. How's that feel?
Good.
Good. All right, I've worked the side of your neck now. How does gallbladder 21 feel right on this side of the traps? Is that tender?
A little tender.
Okay, we'll work with that. Okay, is it okay if I work that at a stretch?
Mm-hmm.
I'll do that. I'm going to do the head rock first to relax most of those muscles. And don't forget to breathe with this one. Good. Do one vertebrae at a time. Get the chin up as high as you can. Good. How did that feel?
Good.
Okay. So I'm going to do the same thing with my thumb and finger in between the lamina groove. This gets in a little bit deeper with those rotator muscles.
Mm-hmm.
How's it feel?
Mm-hmm. Great.
Right? Okay. Going to do the occipital release now. What I'd like for you to do is just totally relax your head and breathe nice and deep for me. You release very quickly. A little rod going. How's your neck feel?
Good. Not looser. Not as tight.
It's okay if I work deeper then at that stretch?
Mm-hmm.
All right, good. And grab a pillow here. Let me know if I go too deep.
Mm-hmm.
All right, and push against me, 30% of your strength, and breathe. And relax. Wonderful. And I'm going to do a deep longitudinal right in the lamina groove. Good. And let you keep the pillow. And fix your hair. Go. Should feel a lot better.
Mm-hmm.
Good.
That was wonderful.
Okay, we'll start with your arms. Do some rocking. Now it's this shoulder that's injured, right?
Mm-hmm.
Okay. And has it been bothering you today?
Yeah, it's been really nice. It's been okay.
Good. A flarage with body weight.
Good pressure.
Thank you. Fulling. Deep longitudinal, ending right on large intestine 12. Is that tender?
No, not
No?
too bad.
Good. And large intestine 11. Okay, again, that's deep longitudinal, ending on large intestine 11 and large intestine 12. And that twists pretty good. A little bit of tightness in there, but not too
A
bad.
little tender, not too bad.
Good. Friction. Friction the wrist at a stretch. And there's some limited range of motion right here. Is that cause of an injury?
It's from gymnastics and my shoulder.
Okay. Large intestine 4, small intestine 3, finger rotations. Great. Okay, friction at the elbow. Friction the triceps, and there's some limited range of motion in here I'm feeling. Your delts feel a little tight. So what we're going to do is a P&F then for the deltoid right in here, okay?
Okay.
So what I'd like for you to do, take it to a stretch and push up against my hand, 30% of your strength, so that this muscle is contracting. Good. And relax. Okay, we're going to change that to this deltoid. And using this posterior deltoid, resist up 30%. And breathe normally. And relax. Okay, now we're going to switch that to a rhomboid P&F right back here. So what you're going to do this time is resist using these muscles right here to try to retract the scapula. Okay? Go ahead. And breathe. And relax. How's that feel?
Good.
Ringing. Okay, let's do a P&F for your pec major. Let me warm it up here first. Is that sensitive?
A little bit.
Okay. I'll also work this from the sideline position. Okay, using this muscle here, I'd like for you to resist up against my hand. 30% of your strength and breathe. Great. Good. Frictioning the bicipital groove, which is even with the axillary. Palm up, it's easier to find. Is that tender?
It's a little tender.
Okay. Do some vibration there for you.
Feels good.
Good. Would you like some alpanol? Are you allergic to eucalyptus or peppermint?
No.
Also help your sinuses. Let me get some a little bit closer to your chest here. Another PNF that's very helpful for shoulder pain is for the lower part of the upper trap. And let's just pull this down and resist up. And breathe normally. And relax. Good. Okay.
That is good.
Good. The focus of this video is therapeutic massage with a lot of PNF stretches and side-lying technique. So I'm just going to quickly go over the Swedish movements and then move on to the PNF stretches. We have authorized, we have chucking, pulling. How's my pressure?
Great.
Kneading. Keep the body moving with this kneading. You can pull the knee out a little bit to knead the inside of the calf, the gastrocs. Okay. And wringing. Keeping the thumbs together. Okay, areas of friction are below the ASIS. Does that feel a little goosey?
Mm-hmm.
No? Psoas is okay. And the knee, friction. Pushing the patella in the directions that you are frictioning to. Frictioning the insertion.
Actually, that's kind of tender.
Is it tender?
Yeah.
Okay. The insertion of the iliotibial band, and then frictioning down the tibialis anterior and posterior to friction around the ankle. Okay, so we had some tenderness right in through here.
Mm-hmm.
Okay, so that'll be something to work on from the side-lying position also. Flarage. Acupressure points on the leg as a review. We have spleen 10, we have spleen 6, stomach 36, bladder, gallbladder 34, and move it to the side, gallbladder 36. Bladder 40 is, of course, below the leg, right in the middle of the back of the patella. Okay. Some good PNF stretches to know for the leg. If the tibialis anterior and posterior are tight, take the foot to a point. Ask them to resist up against your hand, 30% of their strength, and breathe. Hold for 6 seconds, and then they relax.
Sorry.
Good. And then for the peroneus longus and brevis, take it to an inversion and have them resist in an eversion. So push against my hand here, using these muscles. 30% of your strength, and breathe. And relax. Another great PNF stretch for the gastrocs. Take it to a full stretch with the foot into the forearm. Relax your leg there. Okay, now resist by pushing your foot against my arm, 30% of your strength, and breathe. Make sure your hand is never on the kneecap itself. Okay, relax. And you increased by about 3 or 4 inches there, so that was good. So you can see you can do various PNFs for the calf. Now we're going to focus on a low back PNF stretch. Since I haven't done much warm-up yet, I'm going to do a little bit of warm-up for the hamstrings.
Oh, that's gross.
Okay. With a low back stretch, the knee is bent and taken to the chest to their full range. Okay, now resist against my hand, 30% of your strength, and breathe. With a limited range of motion, when you are working on flexibility and tightness, you will want to do repetitions of 3 for these P&F stretches. Relax. Good. And now one for the gluteals. Take it over. Tell me when it's comfortable. Is that good?
Yeah,
okay.
good.
Hold the hip down if you want to focus in the glutes. If you want to focus for the QL, quadratus lumborum, you don't really have to hold it down. Okay. Push up against my hand using these gluteal muscles. 30% of your strength, and breathe. 3, 4, 5, 6, and relax. Good. One more time for that one. 3, 4, 5, 6, and relax. Good. How'd that feel?
Good.
Good. Okay. To ask permission to do the adductors. Is it okay to do a P&F for your adductors? Hold the sheet down. Get them comfortable. Effleurage. All right. Hold down the ASIS on the opposite side. And resist up 30% and breathe. I will demonstrate the joint movement for the hip next. And relax. Okay, so I can either hold this here or I can ask her to hold it. For the sake of the video, I'm going to ask her to hold this. And rotate. Full rotation. Nice and slow. See, she has full range of motion here. I'm noticing a little catch as I work around. Right here, there's a little catch there. That's typical of a tight psoas, iliopsoas muscle. So that tells me that it would be very helpful to have a P&F of the psoas. So what I'm going to ask you to do, Jenny, is very carefully move to the side of the table so that your waist isn't at my hip. Okay, now I'd like for you to bend this leg slightly. That's good. And I'm going to drop this leg down on the side of the table. Now, what I'd like for you to do is resist up with this muscle with about 30% of your strength, the same you've been using. Okay, go ahead. I'm going to stabilize with my other hand on the opposite anterior superior iliac crest. Okay, that's about 6 seconds, so relax. Good. Let's do that one more time, please. Lift up 30% of your strength, focusing on this muscle right in here to do the resistance, the psoas attachment. And relax. Good. We gained some flexibility there, so that should feel a lot better. If you would slide back on over to the other side, that would be great. We are going to move on into side lying now. Okay? You already have a pillow for your head, so what I'm going to do next is to take this bolster out. Okay? I'm going to lay it here next to your hip underneath the sheet. I don't want you to move yet. Okay. I'm going to give you a pillow to hug. Here you go. You're going to hug this. And now what I'm going to have you do in just a moment is turn on your side facing me, put this leg over this bolster, keep this bottom leg straight. Okay? Okay, whenever you're ready. Thank you. That was good. Okay. All right. Okay, I'm going to drape into the underwear. And we got here good range of motion here. And lift the arm up. Put my hand on the anterior deltoid, the other hand on the scapula, and do rotation. And for modesty, hold the pillow with my movement. She's got very good range of motion with this starting out. Okay. A few stretches. Thoracic stretches. How's this feel?
Great.
Effleurage. Watch your body posture with this positioning, because some people have a tendency of not squatting enough and their head will tilt. You don't want that to happen. Kneading. Pulling. Focus your energy on the upper side of the back. You can do a few of the movements for the lower side, but keep in mind that you're also going to work that area when she turns over to the other side. Okay, let's do some nice neck work first. Effleurage. Forearm effleurage. Deep longitudinal. With the broad part of the forearm. How's that feel?
Good.
Is it okay if I go up into your hair?
Mm-hmm.
Does that feel nice?
Mm-hmm.
Makes it a long, flowing stroke. Go all the way up. Grab the upper trap. Rotate the shoulder. If you haven't done any neck work prior to this, you can get your frictions in at this point. Fullings. And kneading. Deep longitudinal in the lamina groove. And friction at the skull. Sweep. Phalange sweep. And stretch. Okay, so we've worked the neck area well. If it was very, very tight, I could take her arm up, get it at a 90-degree angle with the body, and that would counter-strain most of these shoulder muscles and friction at the top of the shoulder. Friction the levator scapula at the superior angle. Okay, good. We're going to focus now a little bit on the back, on the rhomboids, going into a friction with the knuckles. You can stretch them out a little bit by moving the arm forward. All right, now we're going to counter-strain them, the opposite of a stretch. Put your elbow into the table, the thumb pointing towards the ceiling, and pull the scapula back. The scapula should move easily in the four different directions. Lateral, medial, superior, and inferior. So her scapula moves quite well. Okay, you can work the latissimus dorsi by sweeping it over the superior hand. Rib break. I'm going to change position for that so that my fingers work right into the intercostals, gliding in between the ribs. If I want to get deeper with that, work serratus anterior, I'm going to change the position of her arm into a bit of a stretch, effleurage from the elbow all the way down the side of the body to the iliac crest, and stretch the iliac crest, pushing it towards the knee. Let's do that again. Effleurage from the elbow, down the side, rib cage, waistline, iliac crest, to push it towards the knee. Okay. It's tight back there? Okay. We will work that area as soon as we're finished with the shoulder. Frictioning right now the infraspinatus, subscapularis. If it's sensitive, just add a compression to it. Or if it's not that sensitive, you can friction it. I'm frictioning right now the teres, for the teres insert, major, minor, and latissimus. And that's tender? She says yes. I'll do some vibration. Would you like me to work it as a trigger point? Okay. This is at a stretch. She's tender, so I'm going to counter strain it and work it as a trigger point in a counter strain position. So let me know when I'm at a comfortable pain level of 6. And there. Okay, breathe. Is it referring anywhere? Is it releasing? Can I go deeper? Okay. How is that? Let me know when I'm at a 6 again. Okay. No referral? I can go deeper? Okay. Then I think I'll take it to a stretch with the same pressure. Is that deeper? Right there? Okay. And that's long enough. So now we have to do a P&F from this position for the teres. So what I want you to do is resist against this hand, okay? Going forward with your pressure. And breathe. This is 30% of your strength. Another deep breath and relax. Good. Does that feel better now?
Yes.
Good. Another area that's important to work is the front of the shoulder, the pec major, pec minor. And for that, I'm going to switch positions back to the back and friction along the clavicle with the middle finger on the clavicle and the 2 other fingers working on each side of it. So you're working subscapularis, I'm sorry, not subscapularis, but the subclavius that's right next to the sternum and on over to the pec origins. If it's very tender, you can grab the upper pec, squeeze it, and rotate. Okay. How's that feel?
Good.
Kneading, deltoid friction, frictioning the deltoid tuberosity, kneading the biceps and the triceps, effleurage, and this is also another good position to do a P&F stretch for the shoulder. Stretch it down, resist, stop 30% of your strength, and breathe. And let me repeat, keep in mind that you should do these P&F stretches, relax, in series of 3. Good. And that shoulder should feel pretty loose by now. How's it feel, Jenny?
Great.
Good. Okay, I'm going to work my way down to the lower back now. I'm going to do some warm-ups. I've already done effleurage and stretches. So now I'm doing some kneading. Okay, a couple of other stretches that you can do. Waist twists. Pull the rib cage towards you, push the hip away, push the hip towards you, and the rib cage away. And then we have a twist for the hip. You're going to support your superior hand on the ASIS. And the other hand should hook right into the hip. And is that tender? Let me repeat. The superior hand goes on the ASIS, and the lower hand is kind of hooking along the head of the femur here. And twist the iliac towards you, stretching the head of the femur away from you. And your body should move with this also. And so those are two good stretches. Now, as I put my hand on here, she mentioned that this was sensitive, so I'm going to do some hand waves to relax it. I'm working around the head of the femur. I'm going to do some compressions and circles to move it into friction. I'm frictioning around the head of the femur, which means I'm frictioning the tensor fascia latae, gluteus medius, maximus, and minimus, and the various lateral rotators such as the piriformis. Okay, I'm going to press into gallbladder 30, which is lateral to the head of the femur in the sciatic notch. It's a little hollow right there. Let me know what a comfortable level is for you, Jenny. There, okay, and breathe. And I'm doing vibration with the elbow on gallbladder 30, which is an acupressure point for lower back pain and sciatic pain. Is it feeling better? Okay, can I go deeper?
Right there.
Right there? Okay. All right, I'm going to friction from her sacrum to the head of the femur now to get a friction, a good deep friction for the lateral rotators of the hip. And I'm feeling the bounce of the muscles. So please let me know if I go too deep.
Okay, it's just a little tight.
Okay. All right. Okay. A nice move for the sacrum is a pressure right into the sacrum with a flat fist. How's that feel? You can take this into a traction pull. And you can also cross your hands with that one. QL, quadratus lumborum, the hip hiker. To find it, go directly into the waistline behind the lower erectors and press in and do a sweep. Is that tender?
Mm-hmm. That may be.
If it is, you can press on it and do a further counter strain move by pushing the hip towards your finger or your thumb, whichever you're using. Push pulse. Working there. Friction, the iliac crest. You start at the anterior portion. Work your way all the way around the iliac crest. Friction the sacrum. Skin rolling for the low back. A little tender. Okay, let me know if at any time you want me to stop this, okay? That's tender right in through there. Do you want me to stop?
That would be good.
Okay. Do the hand wave then, or the hand glide for the fascial restriction. She's restricting going in this direction. If I had a stool, I would bring it over and sit down on the stool and do the frictions for the erectors. Otherwise, get into a low squat. Pardon?
A little lighter on the pressure,
Okay.
right up along the scapula area.
Right in here? And effleurage it out. You can do various chiropractic massage moves. You can do the hand beat. Serpentine. Good. This can be done slowly or quickly. Clockwise circles down the spine. Careful of your posture for this work. Keep everything in alignment. And frictioning the lamina groove to check for possible subluxes. And you've got some stringy bands right in through here. Do you feel them? So I'm going to go in between the spinous processes, and you let me know if any of these areas are dull. Does that feel dull?
A little bit.
Little bit? Any of these in particular?
It's right where your fingers are at.
Yeah. Right in there, here and here. Okay, you have some possible subluxations going on in that area. So some counter strains would be very helpful. So let me pull your shoulder back like this and keep you in this position. We have the S moves, where the thumbs come together and the tissue makes an S. We have the push-pulls. I'm working on the rhomboids right now for the push-pulls, and for the infraspinatus, we go in this direction. For the erectors, the push-pulls would go in this direction, up and down. Skin folding, which she needs, but she's not appreciating. Acupressure points. Governing vessel 4 is in between lumbar 2 and 3, so I've count up from the sacrum. Lumbar 5, 4, and 3. So it's right here. So I'm going to do a vibration on it for low back pain. And then we have acupressure points 23, bladder 23, and bladder 47. And those are the main acupressure points to know for the back. And most of those are for lower back. You have gallbladder 21 right here, which we worked earlier. And you're actually pressing in on that when you do the upper trap squeeze and rotation. Okay. Adjust the draping, and now I'm going to work the hip and the leg from the opposite side of the table.
Thank you.
Okay, undraping the leg from the here. Feed the sheet through, tuck into the underwear. If they don't have underwear on, you'll have to be a bit more cautious with the underwear. Hook it around the head of the femur so that you have access to the head of the femur, and tuck underneath the leg so that this leg is exposed all the way to about an inch away from the sacrum. We're going to start with some warm-ups and work the leg from the sideline. We're going to do effleurage. Some petrissage movements, got kneading, and if you will think back, the insertion of her iliotibial band was sensitive, so we're going to work that from this position. Her tensor fasciae latae is also tight. That is found anterior to the head of the femur and between the head of the femur and the ASIS. So friction that area because that is a sensitive area in a lot of people. A good way to work that out is to do a push-pull on that move. On that muscle, put your two thumbs on the origin insertion, push together, pull apart, push together, pull apart. And that's a nice way to work that muscle besides frictioning, which can be a little on the sensitive side. Okay, we've already warmed up the hip from the previous side. So now I'm going to friction around the head of the femur again. Bear claw with the knuckles working. all the way around. Don't do the deep movements on the femur itself. Using deep movements on a bone can be very, very sensitive and cause pain. The deeper movements are over the fleshier areas. We have fulling. Bringing works well from the side position. Checking. How's my pressure? Okay, to work the IT band, we're going to compress and lift. Compress the IT band and lift. Compress and lift. Okay, bending the band. And you can tell hers is a little tight because it's not pulling up much. Okay. Okay. There. And now I'm going to press in and friction at the insertion. Is this tender? No. No? Feeling better?
Yeah.
Okay. And then you can friction down the peroneals, peroneus longus and brevis, to around the ankle. There is a way that you can counter-strain piriformis from this position by pushing the knee with your body in towards her. So if this area is sensitive, this is a nice way to work it also. To do a few stretches, we can do a PNF for the psoas, and we can also do a stretch for the hamstrings. We'll show the stretch for the hamstrings first because it's from this position. Be sure that you take the sheet with you, support the leg, one arm above the knee and one arm below the knee, and stretch, and just lean back, taking the sheet with you. Keep a slight bend in their knee. If you would like to change this into a PNF stretch for tight hamstrings, what I would have her do is resist against my hands, 30%, and breathe. And relax. Good. And we got some more flexibility there. Okay. Now a psoas stretch from this position. You're going to take the leg in the opposite direction towards you, supporting the leg, if you can see where my hand is, at the knee to bring it back. Okay, now I'm going to change my position here so that her leg is in my waistline and my hand is above the knee so that it's not on the joint. And now resist right here where my hand is. Push towards my hand, 30% of your strength, and breathe. And relax. And as you can tell, it's going back further. Be cautious of the draping here. Lay the leg down gently on the opposite side, and undrape the adductors for the leg on the table. Some various movements for the adductors and for the leg that's resting on the table, besides your regular Swedish, are compressions and counter strains. Press down and push together. And that feels great for anyone that has any first-degree adductor strains. Jostling also works well. Sometimes kneading might be a little bit too sensitive for some people. Move over here, work the foot a little bit. Haven't done any footwork today. Okay, and effleurage, nerve stroke, and reed rape. Good. Okay, I'm done with this side. Please watch carefully as we have her move over into the other position to work the other side. Okay, Jenny, I'm going to take this bolster out from underneath your leg here, and I'm going to bring it over on the other side. And I'm going to place it next to your hip underneath the sheet. Okay? So I'm going to drape the sheet over the bolster, hold it down with my body, straighten everything out here. And what I would like for you to do, please, is to very slowly turn over facing me, keeping your top leg over the bolster and your bottom leg straight. Very good. Thank you. Now, is this comfortable? Do you want this in any other position?
Yeah.
Does that feel good? Super. Okay. Slide on over to the back. Okay, draping again is lay it over and tuck it into the underwear like this so that this is accessible. Keep in mind that she has the pillow here to keep the back up straight at a 90-degree angle with the arm and the back, and this pillow should be keeping the head at a 90-degree angle so that this is at a right angle right there. Okay, and we will start again. So please work with me with this. This tape will be most beneficial for you if you will be working on a body at the same time as I am. Effleurage, our focus is on the upper side again, and I'm feeling some pretty tight rhomboids right in between the scapula and the vertebrae. Meeting. Deltoids, upper traps, supraspinatus, levator scapula, infraspinatus, subscapularis, teres are tight. Okay, pretty good with the warm-up. Let's start the work now. This time, since the rhomboids are quite stringy today, we're going to start with that. So I'm going to get my body into position so that the elbow is into the table, the thumb is pointing towards the ceiling, and get a movement going with the scapula so that it comes back. And my thumb reaches inside the scapula, working the rhomboids. I can do this at a friction or just a compression. They're both very, very helpful. If you happen to get a client whose scapula does not move back, you'll have to work on that first. You'll want to get this lateral and medial movement flowing, and some of the best ways to do that is to friction it as you push the scapula in the directions that you want to go. Superiorly and friction, inferior and friction at the inferior triangle, laterally and friction laterally, and medially. And this moves quite well, as you can see. To see a P&F specifically for the rhomboids, this is a nice position to do it in. I'm going to hook my hand underneath the scapula on the medial side, stretch it out, and I'm going to say, Jenny, resist against my hand by pulling your scapula back, retracting the scapula. And breathe. Relax. Good. How'd that feel?
Good.
Good. So I've worked this area quite good. I'm going to get into the joint now a little bit. Do some friction for the delts, teres. To work the upper shoulder again, I'm going to counter strain it by getting a straight line here and doing a deep longitudinal up the upper trap. How's that feel?
Okay.
Friction?
A little tight.
Yes, it is tight. Pincer palpation for the upper trapezius. Grab